Earlier today, I had a chance to speak with Congresswoman Robin Kelly from Illinois, who serves on the Health Subcommittee of the House Energy and Commerce Committee. She is also chair of the Congressional Black Caucus Health Brain Trust. Here's my conversation with the Congresswoman.
Congresswoman, great to be with you today, and thanks for joining us. Today is an interesting day. Vice President Kamala Harris put out a statement just a couple of hours ago saying this is the first White House Maternal Health Action Day. And I know you care about maternal health, and maternal health in the United States has become a real crisis, which is shocking to me in the United States of America. But can you tell us what the gaps are that Build Back Better, that our policy needs to fill, that our viewers need to know, what our healthcare system needs to fix?
Well, I'm thrilled to report that the Build Back Better bill makes permanent something that we passed in the American Rescue Plan, which was my piece of legislation where the Medicaid postpartum period goes from 60 days to 12 months or 1 year. Many times when women have a baby, we think that they may lose their life or get sick the day they have the baby. But many women, it may be 3 months later, 4 months later that they still feel the effects of having a baby. And we want to make sure that they can go and get medical treatment when they need it, not be able to go because they can't afford it. So it's very important that this extension is created, and that now under Build Back Better, it will be permanent.
It's fascinating. And I talked to Representative Alma Adams the other day about the Momnibus bill and the various dimensions of this. But it brings that to the forefront, I think, a bigger issue, which is a lot of Americans, if you poll them, healthcare and how to fix healthcare is a very high priority. If you go into the details, their eyes glaze over because it's a complex, just to be honest. But I think, the big question is for many Americans, where do we go from here? And my view is, you can think about strategic leaps. And we've seen, and maybe in science, something like immunotherapy or, what we did with Operation Warp Speed and vaccines coming on are strategic leaps. So might Obamacare have been a strategic leap. But I'm interested in what we need to do incrementally to fix America's healthcare system, and what was on your dashboard when it comes to how we deliver better health. We look back in 2 years, 3 years, we said we did something better than we're doing now.
Sure. Well, first and foremost, I'll say we have to, which Build Back Better deals with, lower healthcare costs, because you can have the best healthcare in the world, but if people don't have access to the healthcare, then it does no good. And COVID put a bright spotlight on the inequities in healthcare. The other thing is we're very interested in is eliminating disparities and inequities. We're interested in increasing the diversity in the healthcare workforce. There's been many studies that show that you do better when it's someone that looks like you, or at least understands, the reality of the situation. I would like to see, which COVID helped lift up, is telemedicine and telehealth, that if you can't necessarily travel, your doctor can come to you. I'm married to a doctor, and was not really familiar with telehealth, but then when COVID started, he uses it all the time now. So, I think those are some of the things that, we can work on and get accomplished, maybe not diversifying the pipeline so quickly, but telehealth, lowering cost, and things like that we can do. And we can start to eliminate disparities and inequities.
Well, I happen to believe very strongly in telehealth myself. I've never really liked going to a doctor, but it's become a little bit easier for me personally online. But you get at something that is so important for Americans to know about, is that where you're born, what zip code you live in, is the biggest determinant when you look back on someone's life of how long their life is, what their life expectancy, their health, et cetera, is. And so I've wondered whether telehealth gave an opportunity to jump out of that and to sort of, as you said, to generate greater equity and fairness and justice in the health system. But how stable is telehealth, the reimbursability of it? I hear that it's wobbly in the insurance world, but what do you think about that? Because I know we're still in the crisis, folks, but telehealth is one aspect, but there are a lot of people that fear that Medicare, that others may not be solid when it comes to reimbursability down the road.
Well, actually, we have legislation that evaluates what has gone on with telehealth, the good, the bad, the ugly, what needs to be improved, what worked So we have legislation for Congress to look at that so we can improve where improvement is needed. Right now, the reimbursement is like as if you're going to the doctor, but it's only because, we're under a crisis. And I know there's other legislation that members have put forward that the reimbursement stays the same. So doctors are embracing it, and we have to look at this as a Congress to make sure that this was almost a silver lining that came out of COVID, that there's different ways to take care of somebody that people seem to embrace. So, again, we have legislation looking at all of this to see how we go forward.
Congresswoman, I know that, your district in Illinois, healthcare is such a, major concern for folks. Have you found when I talk about the healthcare ecosystem, there are a lot of players, right? They're the pharmaceutical companies, they're the doctors, they're the health providers, they're, pharmacy benefit managers and insurers. There are a lot of players in this world. Have you been able to develop an awareness and connection with them so that when you talk and identify problems, you see this health ecosystem responding or not?
I feel like I have a good relationship in DC and back home with the ecosystem, but I also feel like, people are still a little bit in their corners. And I've often said to the various groups, I wish we could come together, no hearing, no cameras, and just put everything on the table, and solve this problem of how expensive healthcare is in the United States of America compared to other countries. And I know, we do the research and we're the ones that come up with the innovation. So of course that costs money. But then on the other hand, if you don't have insurance, a pill that costs, I'm just throwing it out, $10 can cost $300. And it's happened, to me and my husband when they couldn't find, my insurance card. And I'm married to a doctor, an anesthesiologist, as a matter of fact. But it's happened to us also where we see, the difference in price if you don't have, some type of coverage. So you can see why, people may feel like they have to choose between paying a bill and getting medicine, or, some people have said eating and getting medicine. So we have to, close this gap. And also that's another thing that Build Back Better does, helping to close the healthcare gap in 12 of the states that didn't take advantage before. And that covers about 4 million more people that will have health care. And in my opinion, the more people that have health care and the more prevention we can do, at the end of the day, that saves us so much money. People are not going to the emergency room as their primary doctor.
Another thing you do in all of your spare time is that you chair the Congressional Black Caucus Health Brain Trust. Tell us what the Health Brain Trust does in the CBC.
Right. We're the healthcare policy advisors. I won't say experts because, we have nurses that are in CBC. So I won't say that, but we kind of do the groundwork, like something we just passed out in the last CBC meeting was about HIV and reminding people that it has not gone away since December 1st was AIDS Day, World AIDS Day. And then we laid out, what areas are highest in AIDS. And unfortunately, some of my colleagues have some of those areas and how we can work together for education and awareness for citizens, just like maternal mortality. I've done so much work around that, but all the issues, COVID, we've put on seminars and done different things like that. It's really to enlighten my colleagues and help them with things they might be able to do in their districts. I've traveled to different places like with Steve Cohn, we did something in Memphis on maternal mortality and infant mortality. Val Demings has a high rate of AIDS in Orlando, believe it or not. I would never think that. So I went down and did a health fair with her. I've done things with Congresswoman Barbara Lee and Maxine Waters. We've done things around the country to try to highlight issues that need to be worked on or an issue in a particular area.
Two of the people I've spent a lot of time with lately are Dr. Wayne Frederick, who's president at Howard University, and Michelle McMurray Heath, who is the new president of Bio, and both are Black scientists. And we've talked a lot about how many Americans and communities of color don't see people like themselves in the health system. You referred to that as well. Talk about the talent and how to do it. And I believe for Dr. Frederick and also for Michelle, Dr. McMurray Heath, it's a real priority to begin changing, to getting real diversity, in the healthcare system. And I'm just interested in what can Congress do, or what can the federal government do to help enhance opportunity for young people as they're looking at the options they have, and get a more diverse workforce within the healthcare system, not just as nurses in front. We know those heroes, but as doctors and scientists and those that are, also financially on the upper end of this profession.
One part of it, I do feel, and I tell people in the healthcare arena, they need to go back into the schools. And this is not Congress, in elementary school and junior high school, not wait until college, not wait until high school, but expose young people. And I'm very proud to say that one of the federally funded healthcare places in my district, they started this year an internship program with younger kids. They had 14 to 16 younger children come in. She just told me this not too long ago, and the kids loved it. They loved the exposure. We have to expose, young people and, get them interested in what the possibilities are. I have a neuroscientist, Black female neuroscientist that works in my office. And then I have another, my chief of staff is getting her doctorate in public health. I have a master's degree in counseling and have worked in a hospital some of my career, but we have to expose younger people to it. But the other thing that Congress can do is around how much it costs to go to any type of postgraduate education. College itself is expensive, but if you go on, that's where you really have to pay a lot of money. So perhaps something we can do around that. And just like we on the Hill, we bring Black students to be our interns and fellows, maybe perhaps increasing that possibility where you get exposed to everything. I've had docs work for me, people going to be doctors, just all kind of people because of the brain trust. But the cost is forbidding. And then depending on what schools you go to, you may not even be able to get the exposure.
Let me ask you one last quick question, Representative. One of the barriers, I think, to the investments that you and many of your colleagues want to make, and I've talked to Brad Wenstrup and Debbie Stabenow, mental health, but also, obesity, various other chronic conditions, that are facing Americans, is that, you can model what the benefits will be if America took certain actions, you provided certain therapies. But the way that the costs of these are scored is only the expenses are counted, not the savings, that come over time. And I'm wondering whether there's any hope of beginning to be able to register the predicted savings, that come financially from having a healthier public, if you will. Because if you don't, and you're only counting on one side of the ledger, aren't you undermining your ability to invest in American health?
I definitely think you bring up an excellent point. I think, because that's what you hear people say, that'll cost too much money, that will cost too much money. But we have to begin to look, at the savings. When I even think about other things we would like in Build Back Better, like dental, to save people money on dental, because if you have to go to the emergency room for dental, we've talked about this back in Illinois with my healthcare advisory group, the difference in cost is ridiculous, and I know in ENC, a while ago, we talked about, what savings that this can bring. But yeah, we have to develop a system where savings is included as we score.
Well, listen, Representative Robin Kelly, Vice Chair of the House Energy and Commerce Committee. She's the member of the Health Subcommittee and chair of what I think is really cool, the Congressional Black Caucus Health Brain Trust. Thank you so much for sharing your views with us today.
Thank you so much for having me.
I really like that chat. Thanks so much to Congresswoman Robin Kelly.